So that's another great question. One that most virtually every talk I probably should start with this concept of dementia, right? Which is the D word, and everybody loves the D word, because it's fairly benign, a touch of dementia. I get that all the time from my patients. Well, I just got a little bit. My doc says I'm okay. I just have a little bit of dementia. And that's true. But many of my patients also come in and say, my doc told me I've got a little bit of dementia, but I don't have Alzheimer's disease. And that's because Alzheimer's is the A word for us. The most recent, for years, it has been, back and forth with cancer over the most feared diagnosis. But the latest statistics that came out this year suggest that it is the most feared of all diagnoses. There's no diagnosis, nothing. Cancer, give it to me. Heart attack, do your best. Dementia, no way. That's petrifying. So, but dementia really is just a term that describes problems with memory and thinking interfering with daily activities and functions. So I always tell people, if all I had to do was diagnose dementia, I wouldn't have to do a lick of work. Why? Because doctors really don't diagnose dementia. You all diagnose dementia. You diagnose dementia in those around you when you say, they're having some real problems. Have you seen? He can't even use his knife and fork at dinner anymore. Now, what you've told me is two different things. You've told me there's a memory problem and it's interfering with somebody's functional abilities, the things they used to do. And then I could say, wow, that's dementia. And I could bill you for that and capitalize on the $2,000 that Medicare Advantage is going to give me. Or I could do what a doctor's really supposed to do. And that is tell you, why do you have dementia, right? Now, I say this in simple ways because if you go to the doctor and you say, doc, I'm having, chest pain, severe crushing chest pain every time, I walk for more than, 100 feet. And then your doctor turned to you and said, well, I suspect you have a little bit of a heart problem, so we'll watch it. You would, the first thing out of your mouth would be like, what kind of a heart problem do I have and what can I do about that? And so that's where it falls. So dementia, the umbrella term, but then what a doctor does. So if any of you have been for a dementia evaluation, is a very straightforward, and I see people all the time that are normal in memory and thinking or that have memory problems, and they come in and everybody's always petrified. The more of a memory problem you have, the more petrified you frequently are. And people are brought in. I never wear a white jacket because they think that I'm going to put them all in the asylum. You just want to put me in a nursing home. I don't want to put anybody in a nursing home. As a matter of fact, I want to keep people out of nursing homes. That would be the ideal scenario. When you come in to a doctor's office to be evaluated, certainly a memory specialist, the first thing that we do is we sit down and talk with the person. And I guess there's kind of this blind for those that haven't been through this over, well, I'm not really sure what happened. So I think this is a great topic to talk about. The doc will ask about, well, how have you been doing? Have you noticed changes? What kinds of changes have you noticed? We love to have somebody come along with the person who we're evaluating for memory. That's what we call the informant, right? Like wear a dark coat, sunglasses with your hat pulled down. The informant, what does the informant have to say, right, about this whole thing? So, but what the informant is it's a friend or a family member. And sometimes people with even mild memory problems forget that they forget. And so when somebody comes in to see me alone, I often say, it's maybe a waste of our time, because if you have a memory problem, I can't believe a darn thing that you tell me today. And if you don't have a memory problem, you probably don't need to be here in the first place. So we like that informant. So we will ask those questions, of the person, what are you experiencing? And then of a family member, what are you seeing? And then we frequently will test the memory with a brief memory screen, 15, 20 minutes of testing people. And those of us in the field that practice this way, I'll have we use different memory tests. And so I have some really hard ones and I have some really easy ones. And it's dependent on how somebody's doing, which of those tests we break out. Because at the end of the day, the goal is for us to push somebody to the limits of their memory and thinking. And that is a distressing experience. So it's one of the reasons why people don't always enjoy memory testing, because the tests are designed that you can't answer all the questions correctly. The tests are designed that you will get something wrong. The more you get right, the harder we'll make the tests until you fail. Now, we're not used to that. You go to school, you want to do 100%, everybody wants an A. I've never met anybody, even the worst students I've ever met in my life, have not come to class saying, I think I'm really going for a D this semester. Unless they were F students and they're trying to bring it up a notch. Almost everybody's trying to score 100%. So that memory testing can be a little stressful. And then, of course, a physical examination. There are many things that we see. I see folks that come in and are brought to my clinic sometimes, and they've been given a diagnosis of dementia or even Alzheimer's disease. And when I examine them, I say, by golly, it looks like you have either had a stroke or a brain tumor. There's a little bit of weakness on the right side of the body, something focal that we pull out. And so that exam is very, very important as well. And then there's something that they call the practice parameter for the evaluation of memory problems or dementia. And a practice parameter is like a cookbook, like the chef probably used to make the lasagna this evening. Let's put in a little of this, let's put in a little of that, and at the end of the day, we make a dish. So our practice parameter for evaluating memory problems is to do some blood work. And it's not blood work that your doc does every day. So we check certain vitamin levels, folate, B12. Now, if you ate your salad and had vegetables this evening, you probably have a good folate level. If the lasagna had meat in it, did it have meat or was it pure vegetarian? It had meat. If you ate your meat tonight, you probably have a normal B12 level. Not always, though. Sometimes people will have trouble absorbing those vitamins. Your thyroid. Now, if you go to your doctor and you say, doctor, I feel fatigued, I have no energy, my hair's falling out, and I feel cold all the time, he'd say, well, it's just March 5th in Kentucky. No, he would. He'd say, well, we need to check your thyroid. But without those complaints, they're not going to check your thyroid. What we see in our research program that follows normal people in the community, many of them that live here, when they come in and we see a memory problem on the memory testing and we send them for that evaluation, 1 out of 3 will have a vitamin deficiency, a thyroid problem, or something on their MRI scan that's responsible for their memory and thinking, that in most of those cases, 1 out of 3, we fix. Is that unbelievable? Everybody says, Dr. Jicha, you don't have a cure for Alzheimer's. You don't cure anybody. Well, 1 in 3 people that I see with a memory problem, I cure and fix that problem. We pursue that. That includes a picture of the brain and some blood tests. And that's the evaluation. It's really not a scary process. And the goal is to find if there's a problem. I can't tell you, my patients also, many of them, the other thing that we dread besides the A word is he going to put me in a nursing home? I already told you my goal is to not put anybody in a nursing home. My goal is to keep people out of nursing homes, to keep them dependent or independent. And the other one is the driver's license. Dun, 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 dun. Right? Nobody likes that. Everybody's like, you're taking my driver's license away. And sometimes we do have to take away the driver's license. You'd be surprised how mild a memory problem one can have before they are not able to safely operate a motor vehicle. So that is something, that I do have to do on a regular basis, sometimes as a part of that initial evaluation. Very, very important. How do we know when we need to talk with somebody about stopping driving? Is a very interesting question. It was studied once by us and then studied again. And there's a practice parameter out there, which is a cookbook as well. And it gives us a list of if somebody has this, and this, they cannot drive. And how we came up with those numbers was there's something called the National Institute of Aging Alzheimer's Disease Center Initiative in the United States. Your tax dollars at work. I already told you guys, you may not have had to pay to get through the door for your dinner tonight, but you do pay my salary. So that National Institute on Aging collects data on tens of thousands of people around the nation. And we've been doing this for 35 years. And so we had a ton of data. And what we did was we gave that data and linked that data to the driving records, to tickets, accidents, the recorded, and linked the data up, memory and thinking testing in people as they age, and their driving record. And we asked the simple question of insurance actuaries. Does everybody know what an insurance actuary is? They're the people that set the rates. They're the people that say, oh, you have loan forgiveness or whatever, first accident forgiveness, or you're not so good. So when I was 16, after I totaled my third car, the insurance company came back with a price quote for my insurance that was so astronomical my parents couldn't afford it. And my parents said, well, we won't let him drive. And they said, nope, he's got a driver's license, he's in your house. You have to pay this. I had to go in and voluntarily surrender my driver's license to get my parents out of having to pay that much. But anyway, when it comes to memory and thinking, we asked them how much. And so they started looking at the memory and thinking test, and they were like, well, this person will give them their yearly insurance for $800. And, a little bit more memory problem, they were like, $1,500, $1,800, $2,500, $4,000. And all of a sudden they were like $0. We're like, $0? That's great. Free insurance. And they said, no, there is no price that this person could pay that would cause us to want to insure them. Their risk is too high. And that's the criteria that we use nationally. We use the criteria based on the insurance industry saying, it's such a place you are completely unsafe. How do we police ourselves? Simple ways for us to police ourselves in our day in, day out life as well. And that's important. The one that I use for driving is called the white knuckle test. And that test applied to me when I was 16. And that was, you look over at the person next to you while you're driving, and if they're hanging on like this for dear life and their knuckles are white, probably shouldn't be driving a car, right? It took me a few years to mature before I could do it accurately. Important. I'm sorry, I got carried away with driving and I lost track of my thought. We were talking about the evaluation. If we find somebody actually is coming down with a dementia, then we give them memory medicines. And we do have memory medicines and memory medicines that work quite good. They've gotten a bad rap, and that's because they don't work as good as Alzheimer's works. Meaning, no matter what we do, no matter how we're helping somebody, Alzheimer's is stronger. And it will progress over time. But we've had folks who have come into my office not being able to drive, not being able to. One of my patients was a retired professor of English literature, and his favorite passion was reading, and he no longer could read. And he was miserable, miserable, miserable. And we put him on the memory medicines, and boom, he started reading again. And all of a sudden, his test scores were above the cutoff for driving, and he went back to driving. He actually went back at age 87 and taught a course at the university, gave a few lectures as a retired professor emeritus, somebody who a few years earlier could not read. See Dick run, run Dick run. That to me is amazing. So impressive.